Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers, and today, some good news for global health. Since 2021, countries have been drafting a pandemic treaty aimed at ensuring there's a better global response to the next pandemic. On April 16th, the WHO announced that an accord was reached in the world's first global pandemic treaty. Dr. Alexandra Phelan, an expert in global health law with the Johns Hopkins Center for Health Security, returns to talk with me about the treaty, some exciting inclusions, next steps, and what it means that the U.S. was not at the table. Let's listen. Alexandra Phelan, thank you so much for joining us today on Public Health on Call. So you're back on the podcast to talk about an update to a really exciting topic, the pandemic treaty. Can you give us a quick background on the pandemic treaty and how we got to where we are now?
Yeah, absolutely. Thanks for having me. It is an exciting moment to be back. It has all just happened. So about 3 years ago, in the wake of the peak of the COVID-19 pandemic, WHO, World Health Organization, member states decided that they wanted to review the international system, and as part of that process was they wanted to look at creating a new international legal instrument to address many of the gaps that was seen during COVID-19, particularly around international inequities in vaccines, diagnostics, and therapeutics, but also some of the gaps that had been recognized in previous outbreaks like Ebola and Zika. And so they started this process of negotiations and launched in Feb 2022 was when they kicked off. It wasn't for another year and a half, though, before they got to an actual negotiating text. And treaties, typically, the negotiation process take a decade. They are not short processes, but they had a really ambitious schedule. In May 2024, they met for the World Health Assembly and hadn't been able to reach agreement, so they extended for another year. And so after 3 years, a year and a half of text, on Saturday morning at 9 a.m., countries worked through the night and came to very close to consensus and adjourned, came back together, and just yesterday, in the early hours in Geneva, managed to have a complete consensus draft text. They're all in agreement on the terms and the language and a process going forward. So the next step will be the World Health Assembly next month in Geneva, where they hope to adopt the draft text. And, we can talk about what the next steps look like, but that'll be a pretty monumental event, assuming that all goes through, and it likely will.
And I think we should talk about those next steps. And first, just to date our conversation, we're talking on Thursday, April 17th. This episode will likely run next week. So just to give our listeners a time frame of what we're talking about here. But tell us what's happening next.
Yes. Once the draft text is adopted, it will launch a process to negotiate one of the really tricky issues that came up during negotiations. And the idea is to craft a new annex that will become part of the agreement. But countries knew that they needed a little bit more time to work out the details, including technical input. So that is called the Pathogen Access and Benefit Sharing Annex. And the treaty itself, the text contains provisions about establishing a pathogen access and benefit sharing system, which is essentially a system for the sharing of pathogen samples and their genetic sequences, and then the equitable sharing of benefits that arise from the use of those samples and sequences. So things like vaccines and diagnostics and therapeutics, they rely on those sequences and samples to be created and tested. And that equitable sharing really goes to the heart of many of the issues seen during the COVID-19 pandemic. So countries will negotiate that likely over the next year or so in an intergovernmental working group, but potentially sooner, potentially longer. And once that is adopted by a future World Health Assembly, then the treaty can be opened for signature. And when the treaty is open for signature, countries can then sign it and ratify it, and then they become parties to the treaty, Once there are 60 parties to the treaty, add 30 days, and that's when the treaty becomes into legal effect and becomes legally binding. So it is a bit of an uncertain, timeline going forward. But, given we've seen the negotiations go so fast, consensus reached, in many long hours, but in a relatively short time frame, I think the hope is that these next steps will happen relatively quickly, and we can move to an international agreement that sets the standards for pandemic prevention, preparedness, and response.
What are some other aspects of the treaty that you're particularly excited about?
Yeah, so I mentioned this PABS, pathogen access benefit sharing. That's been a particular focus of mine for nearly 10 years. And so I think seeing that come together is really exciting, and I think is at its core about rectifying injustices in science, as well as access to countermeasures. And so I think that's really exciting. There's some other tricky issues that were big. The first is prevention. So how do we prevent pandemics? Thinking about the upstream drivers, which include things like climate change and biodiversity loss, as well as spillover of zoonotic pathogens that move from animals to humans, and from humans to animals, and sometimes back again. And similar to that, there's also provisions specifically on the concept of One Health, which is this idea of taking measures at that interface between animals, humans, and the environment. Technology transfer was a big issue, particularly last week. It really became a focus on, how do we incentivize and engage with industry in this process of building global capacities to produce vaccines, therapeutics, and diagnostics. And so there's provisions in there around technology transfer that really try and balance the perspectives of countries and different sort of views about intellectual property. I think, there's some of the key issues, but some of the parts that I'm excited about that haven't gotten much attention. There are articles on healthcare workforce, on protecting and retaining strong healthcare workforce, so doctors, nurses, and other allied health professionals. There are provisions about building and strengthening health systems with a goal towards universal healthcare. These are the things that are often forgotten. These are the big systemic changes that really address inequities, and I think they shouldn't be discounted. The final thing that I'm really excited about is the governance arrangements, and that's the international lawyer in me. But I think we often see treaties as the text and nothing else. For me, I see the process of negotiations and then the structures and institutions that the treaty creates going forward as just so important. That's what builds trust. That's what repairs the fractures that we've seen over the last 5 years. And in a particularly difficult geopolitical environment, that's so valuable and important. And so, the treaty establishes a conference of parties that will meet and come together to interpret and build guidelines and further steps and details to implement the treaty. And I think those sorts of structures are actually really important because they put pandemic prevention, preparedness, and response onto the table of leaders at the top levels of government, so that this is a continuous conversation and not just written and forgotten.
When we talked previously, the summer of 2024, it was because they had actually missed a deadline that they had set up to sign this treaty. Was there anything between then and now that maybe didn't make it in, that you were disappointed to see was left on the cutting room floor?
I think what was surprising is, I guess, so much did make it in the end, but the process of compromise and negotiation did mean that some of the more binding, really clear, direct obligations kind of got watered down or got limited in some way by, subject to the availability of national resources or national laws. And so, I think that's kind of one of the bargains that gets made in the negotiation process is that if you want a legally binding treaty, how willing a country is to sign up to something that, is going to cost them money, attention, time, technical capacity. And so that's a careful balance. So I think it's understandable, but I think, there's always a desire to have as strong language as possible. I really like that this treaty does capture expressly the right to health. I think it would have been great to have more human rights language in there. Right now, the treaty does, include the principle of respecting human rights and the right to health. There are other aspects to human rights, like protecting human rights and fulfilling human rights by sort of protecting them from third parties, so not just, governments, but, other actors. And, I think that sort of language would have been really beneficial. But I hope that, this foundation at least gives the opportunity to build on that through the COP process going forward.
There's one noticeable thing here that was not there before, and that is that the U.S. was not part of this negotiation and is now not part of this treaty.
Yeah, absolutely. I think, when the United States announced its intention to withdraw from the WHO, which is scheduled to go into effect in January 2026, they also withdrew from the negotiations process. And, I think it's probably not common knowledge, but in this process in particular, but this does happen around other negotiations, but the US played a really critical moderating role. The negotiators were deeply engaged on the issues. They tried to foster good faith discussions. And in many respects, I think other countries often rely on the US being in the room so that they don't necessarily have to take certain positions quite strongly. When the US withdrew, I think that was a real loss to the process. I think it did force countries into perhaps more adversarial positions than they are normally used to playing in this sort of environment, or at least, not having to take on themselves. And, I think that did affect the last, week and a half or so of negotiations in particular. And I think it's a loss because, the US's input, I think, is vital to this sort of international agreement. I think there is still scope for either the US or potentially US pharmaceutical companies or others involved in pandemic prevention, preparedness and response to be involved in some way in the process, particularly the PABS annex, the system as it comes into play. But, it is a loss, and it's a lost opportunity, not just for, the United States, but also the world. So, here's hoping that in time there's opportunities for the US to be re-engaged in the process.
Yeah, and I think especially it's on everyone's minds as we're looking at things like H5N1 and Mpox. All these things are really top of mind. Anything else you want to add about this?
I think that there is, going to be a lot of very valid sort of picking apart of the text. But I think it's easy to forget just, how intensely countries have worked and how this has been prioritised, how much time and energy countries have put into this. And, nothing is in there without very careful thought. There quite literally were hours of discussions around single words or commas. This is a treaty that I think reflects a really great achievement, especially in the current environment we are. I think it is a reaffirmation of multilateralism as a process for solving problems and working together internationally. And I think that, as we have hopefully adoption in May 2025 at the World Health Assembly, and then, the future that we spoke about before about entry into force, I think recognising that these are the foundations for making a safer, more equitable world.
Well, it's really nice to talk about something that's a big win for global health these days. Alexandra Phelan, thank you so much for joining us.
Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.